Hello.
Hey JJ.
How's it going?
Good, how are you?
Oh, I'm doing pretty well. Thanks for tuning in with me, with us. Excited for a good session.
Me too.
Good, good.
How's your day going?
My day's been good. You just been in here in the office. We're, working on stuff. It's been a hectic time, obviously, so just working on a whole bunch of different things. How about you?
It's been cool. I've just been at home.
Yeah,
Just
I
staying
know.
in.
That's most people, hopefully, who just also
Yeah,
at home, just chilling, right?
exactly.
Exactly. All right, we'll probably wait for some people to tune in here. I like your little setup you got going on. Mine's just in the office where we always film these, so yours seems much more
Thanks.
comfortable.
Yeah, it's good.
Gotcha. Cool
Hello,
stuff.
everybody.
Oh, Orlando, what's up?
Yes, hi, Orlando. Hi, Essence.
I know, Paul and I were just talking about how we didn't even have the lights on in here before because it looked like so bright because it's still so bright outside today.
Yeah.
So
It's so nice out today.
it is. Everyone should go for a nice social distancing walk today.
Yeah, exactly. A little walk won't hurt anybody.
Oh, not at all. Unless you got allergies like me, I have the worst seasonal allergies.
Yeah. So it just it makes everybody scared.
I know, right? Like I have it's mostly like my nose runs and stuff, but I'm like, I got those allergies going bad for me. Those cherry blossoms are not good.
All right, let's get started.
Into it.
All right, guys. Hi. Thanks for joining us on our live today. My name is Sol. I'm one of the social media influencers for Whitman-Walker, and I'm also an employee and host of their Floetic Uptown Youth Open Mic. So welcome. Happy Women's History Month. Today we are joined by JJ.
Hello, everyone. Yes, I guess I should introduce myself. So my name's JJ. I'm one of the I'm actually the social media outreach coordinator here for the community health department. So I have been working with Sol and all of our other amazing influencers and with our community health team to give y'all all this great content. And I also am a health educator here, so I do HIV and STI testing, know a lot about all the public health stuff that we're doing here at Whitman-Walker. So it's just the roles I play here, and obviously an employee, just like Sol.
Yeah. So today we're just going to be talking a little bit about women's health since it is Women's History Month. So happy Women's History Month to everybody out there.
For sure.
That's all women included. So one person that we wanted to pay homage to today was Mary Edwards Walker. She was one of the second women to graduate from medical school in the United States. She's known for dressing in male presenting clothes and was arrested for it a bunch of times. But she moved to DC as part of the Union Army as a volunteer assistant surgeon and was providing care for the front lines during that time.
Yeah, I love our namesake. So
yeah, exactly. Yeah,
gotta
she was really committed.
To the OGs.
Yeah, she was really committed to care and community in the face of gender and sex discrimination. So her work is very aligned with Whitman-Walker.
Totally.
Yeah. What else? What else did I want? She also had a Medal of Honor that actually they tried to take it away from her. And she refused to give it back to them. And
they tried to take it away from her because she was a woman, and then she was like, no, it's mine.
Yeah, and also because she wasn't in direct combat with the enemy. But then President Carter gave it back to her.
There you go.
In 1977. Yeah. But I like that we were able to include her in this live because I relate to a lot of wearing clothes that aren't gender specific and being really ambiguous in the way that I dress. And I can't imagine what it would be like to just get arrested for wearing baggy jeans or a big oversized shirt or a button down and a tie. That's crazy to me. And it was also like good to think about like what a Medal of Honor could be now, especially now during the pandemic. A lot of people that are on the front lines are the like healthcare workers and doctors and people who are taking
Yeah,
care of those who are affected by it.
definitely. Yeah, I think it seems like her work is so relevant today. Both just how she identified, I think, and then also again what's going on with the everything that's going on in the world right now. Again,
Right. So did you want to tell us a little bit about how Whitman-Walker is handling COVID?
sure. Yeah, I can definitely talk a little bit about that before we dive a little bit more into women's health stuff.
Yeah.
Since Sol is going to be our expert there, since I don't identify as a woman, but just to tell everyone a little bit about what Whitman-Walker's like COVID response has been. So as of right now, this is all changing daily. So I would say my biggest advice is to check out our website, which I'm sure we'll drop in the comments below too, but it's whitmanwalker.org/COVID service updates for all of our like latest information about what services we're offering during COVID, because again, it's always changing. So as of right now, we're moving all of our appointments to telehealth, which has been quite the process for us over the last few weeks, days now. So the only in-person appointments that we are seeing are related to our respiratory clinic. So our respiratory clinic is taking place at our main clinic location, which is at 1525 14th Street Northwest, and then also at our Max Robinson Center, which is down in Anacostia. That's our southeast location. So those two locations have a respiratory clinic where if you are a patient of Whitman-Walker, you are advised to first call ahead because you'll need an appointment to come, experiencing any sort of respiratory symptom that could be related to COVID. So things like a fever or shortness of breath or a dry cough, anything like that. Call your doctor first. We'll definitely ask you a lot of questions over the phone and then see if you need to come into our respiratory clinic for an evaluation also. So that's our main like in-person COVID response. But I would also say to look out for a lot more social media content that we're going to be having going forward. Because again, we still are a huge health center here in DC, and we want to make sure we're still educating people about like healthy decision making, safe sex, all these types of things. So we really are going to start doing that a lot more over social media in the coming weeks, since everyone is practicing social distancing and can't really do as much face-to-face work. So I would say expect a lot more content coming out on Instagram, on Facebook, things like that, where we'll also be updating you on all of our services too. So I think that's the gist of what we've been doing with COVID. And again, always check out the website, I would say. And our phone number, Jewel, or one of our staff members will probably drop this in the comments sometime soon too, but it's 202-745-7000. Those are that's the main line where you can schedule appointments, all that kind of stuff.
So is the clinic only focusing on COVID right now? Are the other services available?
So yeah, the clinic is only focusing on COVID right now. All of the other appointments that you have are going to be through telehealth. So what that kind of means is that your appointment could happen over a phone call. It could happen over a video conference. So for example, like your therapy appointment with our behavioral health team would now be happening on like a face-to-face, kind of like how you and I are chatting right now. That's kind of how we're transitioning all those appointments. Otherwise, our clinic is only open for the respiratory clinic right now. Yeah, so it's the only in-person thing we're doing.
And are you guys accepting any new patients?
So
as far as for the respiratory clinic?
Yeah, so for the respiratory clinic, we are not accepting patients who haven't been with us before, but that you could be with us with like any sort of thing. So obviously, if you have your primary care through us, then that's an option. You can totally come to our respiratory, set up an appointment if you feel like, or call ahead is the first thing, obviously, but then could possibly come into the respiratory clinic. So right now you would have to be a patient of Whitman-Walker to come into that respiratory clinic, but we have a lot of resources coming people's ways. That's going to be in our website, going to be in our social media, where you can also go to see different COVID options, whether it be testing, whether it be possibly linking up with another provider, and this is really changing day to day. Like, we just got emailed another from DC's Department of Health today with more updates on different testing centers and where people can go to seek care and stuff. Like, it literally was put out like a couple hours ago when I was reading it. So that's why I'm always telling people to check our website, because that's where you'll get the latest updates, and to check out the social media, because that's where we'll have all of that too.
Cool. Thanks for sharing that with us.
Thanks for letting me share.
And please let us know if you guys have any questions in the comments. We're definitely looking.
For sure.
Yeah, well, just more so on COVID, we can talk about the safe sex practices that the NYC health community has shared with us.
Yeah, this has been such an awesome resource, for sure. We just posted it on all of our stuff today too, so people can follow along there.
Yeah. So it's basically just some guidelines of they aren't encouraging you to have sex, but if you are going to have sex, they do encourage you to have it with people that are already in your household, if it's possible. And and to encourage other partners, if they are feeling sick, even if they are in your household, to refrain from having sex. You alone are your best partner. Masturbation will not, spread the coronavirus. And the ways that, so far we know that coronavirus can be passed through saliva, mucus, and feces. So we are not encouraging you guys to kiss or rim, which is like putting your mouth on an anus. And if you are having sex, we do encourage you guys to have condoms and dental dams, and just avoid exchanging saliva.
Yeah, exactly. I think you covered pretty much the gamut of it. I think the biggest takeaway is that you are your safest sex partner. So I think you have to look out for yourself and the people who are in your household staying around with you right now. So I think you covered it best. That means that you have to, if you're going to have sex, then try to do that with people who are already in the same living situation, so that you're not going out and about more than you usually would be. Again, washing hands is so important, and not even washing hands, washing any sex toys that you'd be using too. That's really important, because like you said, like the three main places, at least that are related to sex, that the COVID-19 could be transmitted through are saliva, mucus, and feces. So because of like saliva, kissing is a really easy thing that can pass on COVID-19. So just making these like informed decisions about harm reduction, like that's what we always try to say, is what can be best to reduce the harm that could happen on an individual in a health setting. So that doesn't mean that we're telling everyone, don't have any sex through this. We need to completely eliminate all those, eliminate that behavior, because in reality, sex is also can be a really good stress relief outlet and an anxiety relief outlet for people and stuff. So it's just about how to be smart about those things and how to reduce your harm in doing that. So I think that's about what I wanted to say about all of those things too. And from just the Whitman-Walker perspective as well, we are also still going to be working with our patients at Whitman-Walker to work out arrangements around HIV and STIs basically. So make sure you're in contact with providers and stuff. So say, for example, you think you might have an STI or something, then that appointment could happen over the phone to see what's going on there. And then we could possibly prescribe treatment that you could just go pick up at the pharmacy instead. So that's all good things to know as well going forward.
Right. Yeah. Does anybody have any questions so far?
I think I saw any yet. Just lots of waves, which we definitely appreciate.
Yes, we do. Okay, well then I guess I can dive right into the women's health topics.
Yeah, awesome.
As far as women's health, I'll just talk about my own experience first. I think taking care of your body as a woman is definitely different and extremely important to know how to be informed on the signs of your body's changing from puberty to like adulthood. I remember even like just getting my first period in like the sixth grade and not necessarily knowing how to deal with that because I hadn't had the conversation with my mom yet, and like the schools hadn't had that conversation with me yet, so I was kind of freaking out. But as you get older and you learn like how to tell your body cues and how to take care of it and what can change, what can help you cope with like PMS and how to know if everything is all right down there, and making sure you have a regular and consistent healthcare provider that you can ask questions to. And even if you don't have a normal healthcare provider, just being able to find resources that are free, like hotlines that you can call and ask questions, or even just ask your friends. A lot of our experiences can be similar, and we can help each other in that way. Especially now when we're not really able to go and see our healthcare providers as often as we would like to because they're all focusing on COVID. I think it's important for all of us to just, be in conversation with each other and like just stay informed, read up about what your body's supposed to be doing, and if you feel off, like don't self-diagnose yourself. Don't go in whatever, and when they tell you have cancer, don't necessarily believe it. But definitely, yeah. Just make sure you know that changes are happening and how you can fix them. Make sure you're taking care of yourself mentally, socially, physically, emotionally. I know that when you're social distancing and isolating yourself, sometimes it can weigh on your mental health too. So make sure you're still calling your friends and having, like FaceTime dates and sharing the wine glasses over, even on live.
Yeah, definitely. My mom actually, she called me yesterday to say that she's setting up a Zoom happy hour with my grandma that's happening on Saturday. So like you gotta keep it creative and do things like that, right?
Yeah. Yeah, I'm over here trying to figure out how I'm gonna have like a online happy birthday. My birthday's next week, so
oh my gosh, happy birthday!
Thank you. I'm trying to figure out what I'll do online.
Exactly.
Yeah. I was hoping to have more commentary with people about women's health. If there were any questions that anybody had or any experiences people wanted to talk about, we can do that. But safe sex, body positivity, just making sure that, as your body is changing, you're not shaming yourself or just because things are different. If you are having conversations with the women around you, if things are different, not to be discouraged or feel that you're just like not normal or like not fitting in. Like everybody's body is different. Everybody's body reacts differently to different things, and changes as you grow and get older. There were some guidelines from the Johns Hopkins website that they had about women's health, and it was basically just staying informed about your health, taking care of yourself, like I said, mentally, physically, and emotionally, and socially. Don't do drugs, and watch your alcohol intake. I know that everybody's inside and there's not a lot to do, so a lot of people are drinking, but just keep in mind that we're eventually going to have to leave the house. We can't be all turning into alcoholics at the end of the pandemic. And alcohol just has a lot of like water weight and like sugars, and it can turn into liver diseases and things like that. So just make sure that you're watching your alcohol intake. And
yeah, definitely. I think this relates back to even how we were talking when we were both talking about like how to do safe sex in this day and age of COVID and how harm reduction is so important. So again, if you're, it's again unrealistic to expect people to not be drinking when they're locked up in their houses, with their family
Yeah.
and friends and stuff. But it's about what's a safe level of alcohol to drink, how often are you drinking, and just kind of being your own best monitor on like what's a good healthy habit. I think that's the best way to think about it.
Well, we have a question. What alerting changes should I pay attention to when it comes to vaginal health? And when is it a good time to seek medical advice? I think some alerting changes that you should pay attention to as far as vaginal health are definitely like changes in like the fluids and discharge that comes from your vagina. If it starts to smell differently than you're used to, that's always a good time to ask your healthcare provider if something is wrong. It's a good time to seek medical advice, just advice. You don't actually have to go into a hospital, but you can definitely call some healthcare providers and ask questions when you are feeling different, whether if it's a scent, whether it's a fluid, or if you're feeling different, you're feeling like spasms or anything odd in your vagina.
Yeah.
So that's a good time to ask questions.
Yeah, totally. I would say like any sort of abnormal sort of discharge or like rash or bump, something like that, I'd say that's probably a good time to pay attention. And it's always best to call your provider if you have a provider, or you can give us a call too, always. And we can make sure that change is either normal or if it's something that we'll have to look at instead.
Yeah. Yeah, and then if you have like a regular OBGYN, I know that you can get pap smears at least once a year after a certain age. I believe it's 21. But I know that some people get pap smears when they're younger based on like other things, other situations, sexual trauma and things like that.
Cool. Thank you for the question.
Yes, we really appreciate it. Are there any other questions? We are welcoming them now.
For sure.
Let me look at my notes some more. Yeah, I also wanted to talk about like the stigma of like just talking about your vaginal health in general.
Mm-hmm.
I think a lot of the times when we talk about sex ed and like health education, it's a lot of the time based around like sex itself and like pregnancy when it comes to women. And there's, like I said, I like to encourage open and honest conversations amongst my friends and amongst my community. So I think just breaking away from the stigma of not wanting to talk about your vagina or even call it a vagina, and like asking questions about it to your friends and to other people. I wanted to stress the importance of that, just especially for the next generation so that they're more comfortable. Because it's easy to be quiet about what's going on with your body and the changes that are happening if you don't have a community of support.
Yeah, I think for sure. I think to add to that too, I think one, like obviously not all women have vaginas either, and I think no matter how you identify, women's health is really important, even if you're a man too. I think I, for one, see a lot of like stigma out there, like, oh, like a woman's on her period, she's angry, like things like that. And I think it's just
Right.
like everyone needs to just listen and be honest and like have those honest conversations, like we're having those right now. That's how stigma at the end of the day is gonna. I think we'll eliminate some of those stigmas around women's health.
Yeah, for sure.
Mm-hmm. Got some more people joining.
Hello, family and friends. Oh.
Nice.
Yeah, so just going along about community and having conversation, I also have started a meetup group called Femmes Who, and it's for people who identify as femmes. So it's not gender specific. It's not a cisgendered group. It's just for people who identify with the term femme. whether they identify with it all the time or some of the time. Just to, have meetups and meet and talk about things. So if anybody's interested in that, you can follow it. And I want to do like a live forum where we do a happy hour, but not like a drinking happy hour. Just we share what made us happy today. Because I know being in the house sometimes can be like really depressing.
Yeah.
And that, especially if you live alone or if you live in small quarters with your family. How do I talk to my sex partners about getting tested? Any recommendations on starting that conversation? I think honestly and like bluntly is just the best way over anything. You can over dinner, over coffee, at any moment. Just asking them, just having a conversation about sex in general. Just ask them how many partners they've had and if they've been tested and how comfortable they are to share that information with you.
Yeah. I think we got if I was interested in next steps. Yeah, I think people, it's going to be really individual. Every person's situation, every relationship is different, So I think, I'm an HIV and STI tester here, so I see tons of people who are coming in to get tested in a lot of different situations. And I think you just have to start, or like you just need to like find what works best for you in relationships. So I know a lot of people come in and they like make it a whole event and they come in with their partner and they both get tested together and it's more of like we're going to do this for our mutual health together. I think that's a really healthy way to do things. Also saying like, listen, I'm not comfortable doing anything with you until you like do get tested. Like having that as an ultimatum can be really beneficial in some situations too, kind of similar to how the comment was here. And I think just the more we talk about getting tested and for STIs and HIV and stuff, the more common will be, I think, to have those conversations just really quickly like, hey, I think it's important that we should both get tested before we take something and the next step. I think those will be a lot more commonplace conversations that we can have. And I think that it doesn't have to come from a place of judgment at all either. If you are starting some sort of sexual relationship with someone who isn't used to getting tested and stuff, it might not be the best to frame it as like, oh, well, why have you ever gotten tested before? Like, what have you ever thought about? Things like that.
Mm-hmm.
Kind of bring them in and be like, oh, hey, like I get tested every 3 to 6 months usually. It's just a thing I do for my own health. I think it's something that everyone should do for their own health, and kind of like bring them into that conversation and educating them as opposed to, casting any judgment on someone. So I think those are some good tips, at least from what I've seen on those front lines of HIV STI testing.
Yeah. And if they don't want to, share that information with you, sometimes they might not be the right person for you.
Mm-hmm.
So that's important to think about too.
Yeah, very good point. Again, everyone has to make those own decisions for themselves,
Mm-hmm. Always look out for yourself first.
Very true. Any other questions?
So things are really crazy right now with this pandemic. Are women still able to get an abortion during this time? Is that a Whitman-Walker specific question? I'm not sure if other clinics are doing it.
Yeah, I truly don't know the answer to that. I would say possible. Like, I would say that if that's something that people are considering, I guess just look online somewhere for that. Yeah, I don't have the answer to that question.
Yeah, I don't have the answer to that question either. That is something that I had thought about too, though.
Yeah, and I think that like things are just constantly changing in this day and age with things. So I think hopefully just going to like different places' websites, though that's where they'll have the most up-to-date information. Like that's what we have on our website is where we'll get the most up-to-date information. So I wouldn't rely too much on like random, like news reports and stuff because things changes every day.
My question was, can you talk about barriers I can use in different options for different types of sex. Barriers as far as like condoms and dental dams and such. Yeah, so we have some, I don't have any, actually I do. This is one of the packs that the Real Talk DC Youth Services gives out. So we have some condoms in here, some regular lifestyles, and then this is like the equivalent of like a Magnum. We also have lube if people are not trying to do oral sex, but with like the extra fluids, with like the extra help.
Lube is super, super important for any sort of insertive sex, I would say.
Right.
Makes it a lot safer, prevents condoms from breaking a lot of the time, makes it more comfortable for people.
No, this one doesn't have a female condom or a dental dam, but
yeah,
you can also use dental dams and female condoms. And the female condoms are insertive.
Yeah, exactly. So the female/insertive condoms, you can insert those into a vagina or an anus. That can be an option for people. And then the dental dams are could be a good option for like if you were going to be like rimming or something, then that is also a good like protective measure you can take. And then like kind of relating it back to COVID too, that's one of the suggestions that New York City Health made, was that dental dams can be a good way to like prevent any sort of like saliva from getting anywhere, but still enjoying that sort of behavior. So lots of different options, I would say.
Mm-hmm. Let's see. I thought I saw another question. Black Becky says in Alabama you might be able to still get an abortion, and some states like Ohio are saying that it's not essential. I think it varies state to state. Well, if there are no more questions, we can.
I don't think I saw much more. I can wrap up real quickly, just going over like Whitman-Walker's COVID stuff, and then if you want to maybe just end with, you know, some of your experience again, Sol. I think that was really important and powerful to share. So yeah, again, just really quickly in terms of what Whitman-Walker's response has been with COVID-19, we have our respiratory clinic open. I think that with the respiratory clinic is open at our 1525 location and our Max Robinson Center. We are not accepting walk-ins or anything like that. You have to have an appointment first, so you have to call us before coming in, and you have to be a patient of Whitman-Walker. We're preparing to have a lot more resources available to people who maybe aren't patients of Whitman-Walker. But for now, you need to be a patient, and then if you're having any sort of COVID-19 related symptom, then we would be able to evaluate you at that respiratory clinic. So that's our main service related, and then all of our other services have mostly moved to either been canceled, like unfortunately we're not able to do HIV and STI testing right now, but other appointments can happen over telehealth, so it can be over the phone or over like a video conference like this is. And then always check out our website too for the latest updates for what our services is, because this is definitely an unpredictable, uncertain time, I would say, and things are constantly changing every day, week about what could be offered. So to get the most up-to-date information with us, I would say our website, Whitmanwalker.org, that is where you're going to get all the information you'll need to know.
And I pinned the website onto the live, so it's there.
There you go.
Well, I also wanted to just go over the rest of the COVID guidelines that we had gotten from Whitman-Walker.
Yes, for sure.
Just make sure you're continuing to wash your hands and not touching your face. I like to sing, hooks of songs while I wash my hands so that I know that I'm going more than 30 seconds.
Yeah, good scrub. I've also seen those videos now out there where it's like, make sure you're washing your hands all over too, so it's not just like some of this, it's like in between the fingers, like inside, thumbs, all of that. So I've been trying to be better about that too.
Yeah. Make sure you're always using soap. Hand sanitizer is not enough, especially if you're going to the grocery stores and stuff. Make sure that you're not going to the grocery stores and going out too often.
Yeah, we got tell us a song or sing us a song.
Sing us a song.
Definitely, sing us a song is not for me. That's for sure.
Okay, I'll sing us a song before we log off. I want to make sure I'm saying everything that I need to. I posted most of the other guidelines on my story, and I will post them.
The other thing, obviously, social distancing. Everyone, for the most part, I'm sure has heard that now. Means just being at least 6 feet away from other people as much as you can. I know that in like your own living situation, that might be, tough to do sometimes. But just when you're going out to the grocery store, or just as much as possible, staying at least 6 feet away from other people.
Yeah.
Which is why we're doing a lovely live together, not in the same room like we usually are.
Yeah. I'm at home. They're in the office.
I am in the office. Yeah.
I guess I'm gonna be demonstrating how to wash your hands and sing a song.
I could I have my watch on. I could do 20 seconds whenever you're ready.
Okay. That's Sunday, girl.
Oh my gosh, this is amazing. The live on the run.
On the run.
To wash the hands.
What's a song that I've been singing? Real love. I'm talking about real. Someone set my heart free. Real love. I'm searching for real. I met you, I just knew that you would take my heart and run. Until you told me how you felt from me, you said I'm so I slowly came to see all the things that you were made of. And that's like 30 seconds.
Yeah, that was like 40. That was quite the performance. Also an excellent song choice, I may add.
Thank you.
Wow, there you go. I think what a way to close this out.
All right, guys. Thanks for tuning in.
Yep. Thank you for having me, Sol.
Yes. Thanks for joining me today.
Of course.
See you guys soon.
Yep. Stay safe.
You
Wash
too.
your hands.